I would say, the most obvious one is data breach. We see the lost laptops, unencrypted CDs, something that's happening more and more. Obviously at the moment in the UK, ICO is fining, hospitals for loss of data. The fines aren't necessarily insurable, but reputationally this has a massive impact on hospitals. Reputation is actually something that can be insured under a cyber policy nowadays. If you look at things like the Ponemon report, when they look at the cost of a breach record, around about 50% of that is indirect costs, so it will relate to customer churn.
I would say probably the threats that facing hospitals probably are less of a lack of a completely integrated infrastructure. So they're actually spread out across lots of different trusts, which makes it harder to actually protect.
I think they're numerous and they're far wide-ranging, if I'm honest. I think the biggest threat to hospitals are the people that work in them, candidly. And having spoken to our IT security team within Hiscox, actually one of their biggest concerns within any industry is people, followed by software, followed by cyber breach, followed by hardware, which is really interesting because it's actually, the fear factor is actually driving around people's behaviours rather than a cyber breach.
Well, cyber attackers are focusing on the healthcare sector more than any other industry. And this is perhaps unsurprising. The reason is that the healthcare sector ticks all the boxes for cyber criminals. There are valuable medical records to steal from and critical IT operational systems that can be affected and disrupted by cyber attackers. Medical records are really valuable for a cyber attacker. They of course contain a lot of personal information about a person, such as their age, their gender, their current address, their medical conditions, all of which can be used for medical identity theft and fraud. In fact, medical records can sell for up to 10 times the price on the black market than is paid for stolen credit card numbers. Another very prevalent threat that is facing the healthcare sector is ransomware incursions. Cyber attackers are using ransomware attacks knowing that they can exploit the critical nature of medical data, which, if encrypted, would render medical services less effective and clearly disrupted.
What's facing all of us is that we're going through a new industrial revolution and the more interconnectivity, and hospitals are going to deal with robotics, greater interconnectivity, greater digital risks, so they need to change their culture and respond to these new things that are emerging. But that's true for all of us as much as hospitals.
I think the main threats for the hospitals and what they face is the denial of service to the patient care. I think the most important thing is making sure that there is enough governance and awareness in place, which is, I guess from my experience, is a lot of hospitals aren't doing enough to create awareness of the issues and what they should be clicking on and what they shouldn't be doing. So the main attacks is doing phishing and malware attacks. But I think last year 47% of NHS trusts were effectively hacked or attacked by malware. So it's one of the main sort of areas they've got to focus on.
When it comes to the threats facing hospitals by cyber, the threats aren't really any different to those that are faced by other companies. The fact that internal staff may be copying data and exfiltrating it out to other people, whether that's competitors in the pharmaceutical industry. There are obviously a large number of attack threat actors in the environment that are looking to steal data and to sell it for gain. So whether that's nation-state actors or criminal networks. The one thing that I think the NHS specifically and healthcare providers generally can really do to help themselves is end-user training. The understanding by end users, ordinary people who are using computers on a day-to-day basis, of exactly what a threat looks like, who is going to try and take their data and what that attack will comprise, so that they recognise attacks when they're coming in, is an easy way to mitigate a lot of what we're seeing.
I think there's various different aspects to it. The hospital world now has electronic patient records, portals, internet-enabled devices, wearables, telemedicine, all of those aspects. And I think in terms of risk mitigation, it's really important for hospitals to understand how they can actually risk map what their exposure looks like and then take the appropriate steps to mitigate those risks.
I think you've got to think about the technological advancements in the last 10 years and think about the technological advancements in the next 10 years. So let's look where we've got to in the last 10 years. We're delivering medicine through telemedicine, through robotic surgery and wearables, which has been fantastic for patient safety. Moving forward, we will have the ability to 3D print materials which can replace organs, 3D printing of skin, and forget wearables. We're going to have digestible sensors. And when you think of the type of data that a digestible sensor can record, so for example, in a situation where a patient has a digestible sensor and the data is sent to a cloud, the system realizes that the patient is suffering from the neurological symptoms relating to a stroke. In real time, the patient is alerted via the system. The system informs emergency services. They arrive with the relevant data on a tablet. The patient is transferred to hospital. The hospital is aware of the patient's arrival. He or she is treated, and the patient avoids a stroke. I mean, that's huge in relation to patient safety. But think of all that data. And hospitals need to really think about how, firstly, they're storing the data, but secondly, the risks related to them being hacked.
I think it is clear that the political agenda is one which is looking to promote innovation and also cybersecurity within the UK. The government has made a very clear, or given a very clear message that it is going to lead with regard to cybersecurity and the strategy that is required around that. That's obviously evidenced by the recent strategy that the government has published for the next 5 years, and it has committed a significant sum, £1.9 billion, in order to do that. And the fact that it was the Chancellor that announced that gives an indication of how serious that they are taking it. And certainly with regard to the healthcare sector, something that is reassuring is a pragmatic note that they've provided, which is recognising that the NHS, the health and social services are unique, and in terms they will actually present a very unique set of challenges when it comes to tackling that threat, not least with regard to the size of the NHS. It's something like 40,000 organisations that make up the NHS, which in itself is going to present a distinct set of challenges for the government to face.